Viruses and bacteria are two distinct types of pathogens that cause infections, but they differ significantly in structure, behavior, and treatment. Viruses are microscopic infectious agents much smaller than bacteria. They consist of genetic material, either DNA or RNA, surrounded by a protein coat and sometimes a lipid envelope. Viruses cannot reproduce on their own and must infect a host cell to replicate. They hijack the host cell's machinery to produce new virus particles, often destroying the cell in the process. Bacteria, on the other hand, are single-celled microorganisms with a more complex structure. They have a cell wall, cell membrane, and their own machinery for reproduction. Bacteria can live and reproduce independently in various environments, including within the human body. Some bacteria are beneficial, aiding in processes like digestion, while others can cause infections. The symptoms of viral and bacterial infections can be similar, making it challenging to distinguish between the two based on symptoms alone. Common symptoms of viral infections include fever, fatigue, muscle aches, and respiratory issues like coughing and sneezing. Bacterial infections often cause localized symptoms, such as a sore throat in strep throat or redness and swelling in a wound infection, but they can also cause systemic infections like sepsis. Diagnosis typically involves a combination of clinical evaluation and laboratory tests. Viral infections are often diagnosed based on symptoms and, in some cases, confirmed with tests such as PCR, polymerase chain reaction, to detect viral genetic material. Bacterial infections may be diagnosed with cultures, where a sample from the infected area is grown in a lab to identify the bacteria, or other tests like blood cultures. Treatment differs significantly between viral and bacterial infections. Viral infections do not respond to antibiotics, which target bacterial structures and processes. Instead, antiviral medications may be used for specific viruses, and supportive care like rest, hydration, and over-the-counter medications can help alleviate symptoms. Vaccination is a key preventive measure for many viral infections, such as influenza and measles. Bacterial infections are commonly treated with antibiotics, which can kill bacteria or inhibit their growth. It's crucial to use antibiotics as prescribed to avoid antibiotic resistance, where bacteria evolve to withstand these drugs. Preventive measures for bacterial infections include proper hygiene, sanitation, and, for certain infections, vaccines, e.g., for bacterial meningitis. Both viral and bacterial infections can lead to complications if not properly managed. Viral infections can sometimes trigger secondary bacterial infections, complicating treatment. Conversely, untreated bacterial infections can spread and cause severe conditions, such as bloodstream infections or organ damage. Understanding the differences between viruses and bacteria, along with appropriate diagnostic and treatment approaches, is essential for effectively managing infections and reducing the spread of these pathogens.